Leukemias. Leukemia are the first one is ALL. Age group is 2 to 9 years, and specific clinical features are the CNS, testes, and lymph node involvement. And the patient is pallor, fatigue, infection is increased, and bleeding disorder. So CBC findings we will see platelet count is decreased, RBCs are decreased, and the WBC will be normal or increase or decrease. So mainly in the patient, these blood cells are the more than 20%. A blast cell. These blood cells are the more than 20%. Then it will be present as acute in the both the AML and the ALL. So specific stain is the pass positive, and markers are in it is of two types according to WHO classification: BALL, TLL. The BALL is the good prognosis, TLL is the bad prognosis. Tumor marker is 19, 10, CD19 to CD10, PX5, and PALL is CD1, 2, 5, and 7. And in the both, TDT is present or Carl double L presents. So cytogenesis now, if I will show you with the peripheral smear, the hand mirror cells and the ears and the pass staining is positive, and the black dots are positive. So basically, it is about all ALL. Now we will talk about AML. AML is the age group of the 15 to 39 year olds. So AML is the myeloblast. A myeloblast in the blast cells are the more than 20%. These are showing as acute. So basically, so clinical percentage क्या extra clinical feature. The gum bleedings are present, chloroma, DIC. This is the chloroma is the most common site is orbit. Most common site is orbit. So basically, CBC findings are same as the ALL, and specific stain is the MPO is the myeloperoxidase. Myeloperoxidase positive Sudan black P red oil red O, and CD13, CD33, CD117, and the MPO is the marker for AML. Now is the translocation of 8 into 21, translocation of 15 into to the 17, and inversion of 16. These are these M2, M3, M4 is the WHO classification which shows the in the AML. Now is the CLL. Now we are talking about the CLL. CLL is the seen in the 6 to 17 is the elderly persons. Is the acute autoimmune hemolytic anemia. Lymphadenopathy is the clinical feature subset. So the lymphocytes counts are increases, and Sudan cells are increased. You can see. So this is Sudan cell. Sudan cell is the parachute cells, also known as the parachute cells. So markers are CD5 positive, CD23 positive, CD200 positive, a new variant. As a genetically trisomy of 12 chromosome, and deletion of 13q is the long arm, and 17p is the short arms. So CML, and in CML there is the age group is elderly person, is the massive splenomegaly is seen, just like in malaria and all the factors. All stages of a myeloid maturation is the basophilia. All stages of myeloid maturation in the basophilia. Okay. So translocation of translocation of 9 into chromosome. On 9 chromosome, there is a ABL gene. ABL gene. On the chromosome number 22, there is a BCR gene. There is a translocation between these two genes and these two genes, and this chromosome is called as the Philadelphia chromosome. Philadelphia chromosome. So I will show you this. These are the cells and peripheral sensitization. So I told you nerve cells. So basically AML is the AML has the myeloblast have or or rod cells is the myeloblast, and if or red cells are collectively, then is the Fugate cells is thing. Fugate cells is thing. So basically, I will show some differences about lymphoblast and myeloblast. A lymphoblast is small in size, scanty cytoplasm. Granules are absent. So basically, myeloblasts is large in cell. So MPO positive मिलता है. This. Thank you.